Patient-centered, care should be respectful of and responsive to individual patient preferences, needs, and their value structure. Timely, waits, and sometimes harmful delays in care should be reduced for both those who receive care as well as those who give care. Efficient, care should be given without wasting equipment, supplies, ideas, and energy. And finally, equitable. Care should not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, or socioeconomic status. I'm proud to work with our dedicated community of over 20,000 healthcare professionals at university hospitals, which is an extraordinary health system delivering world-class clinical care, performing superb research, and educating the next generation of healthcare providers. Collectively, hospitals, physicians, and others in the healthcare industry have the opportunity to discover new ways of working together to ensure access to reliable, affordable, and high-quality patient care. It's a daunting but exciting time to be part of the healthcare field. So much has changed in the way that we have practiced medicine over the last few decades, and so much more change is on the way. In the words of Winston Churchill, you can always count on Americans to do the right thing after they've tried everything else. You can be sure that we will continue to do the right thing while finding better solutions. We need to ask and answer a fundamental question. What kind of healthcare system are we going to create today that we will be proud to leave to future generations of Americans, a system that successfully balances the cost, access, and quality equation and stands the test of time? Thank you.
Today at the City Club of Cleveland, we are listening to a Friday Forum featuring Thomas Zenty III, CEO of University Hospitals. We will return to our speaker in a moment for our traditional City Club questions. We encourage you to formulate your questions now and remind you to keep them brief and to the point. We welcome you to the City Club Forum. We want to remind you that members and guests alike are welcome to attend City Club Forums here at 850 Euclid Avenue in downtown Cleveland. We hope you will join the City Club and become active in our ongoing civic dialogue. Please visit our website to see a full schedule of our upcoming programs. We welcome guests today at tables hosted by Baker Hostetler, Davison Young, Fidelity Investments, guests of Ken Lancy, the Helen Moss Breast Cancer Research Foundation, Key Bank, Medical Mutual of Ohio, PNC, Vorey Sater Seymour and Peace LLP, MCPC, and University Hospitals. Thank you for joining us today. We are pleased to welcome to our forum students who are here as part of our City Club student program. Participation of these students is made possible by a generous grant from an anonymous City Club member. Today, we welcome students from Ginn Academy and Martin Luther King Jr. High School. Will the students please stand and be recognized? Now we would like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphones today are City Club Development Director Cheryl Heldon and Program Manager Carrie Miller. Mr. Zenty, and first question, please.
Mr. Zenty, you mentioned with great detail some of the provisions of the new law, which are very helpful. You also pointed out some of the insurance requirements that will be necessary in order to have the coverage that the new law envisages. In addition, you said we should look to other countries to see how they have operated their system to learn from that. And my question is basically, the insurance provisions as they now stand seem to be rather complicated, and the ordinary person would be a little difficult to understand and to follow. To what extent do you think that a single payer method of insurance, which was discussed during the discussion in Congress but was not adopted, to what extent would a single payer method resolve and simplify and make possible the kind of coverage which you spoke about?
You know, the concept of a single payer system has been talked about for many, many years. And in fact, it was in 1948 when the British decided that they would undertake a nationalized form of health care. In the United States, we decided to go in a different direction. If there was an easy answer, and if there was one solution, then I think it would be safe to say that that model would be replicated not just in a particular country, but around the world. Single-payer systems have with them attendant benefits as well as attendant drawbacks. I don't know how many of you had a chance to read the newspaper just a few days ago. And in the national press, there was a discussion about problems now that the Canadian health system is experiencing. And they have a single form of payment. And in fact, they are having significant problems because in some of their provinces, 40% of their province's budgets are going to support healthcare delivery. 40%. So, as a blanket statement, it's very hard to say that a single-payer system will solve all of the problems that we are experiencing. Issues in a single-payer system tend to revolve around problems with access, but administrative efficiencies in terms of payment for services are eliminated. That's why when we think about healthcare today, the issue of cost, access, and quality are the three most important components. In fact, there is a Princeton economist by the name of Uwe Reinhardt. And he says the three elements to think about in terms of healthcare provision are cost, access, and quality. But you can never have any more than two of the three at any one given time. Now, he said that many years ago, but I think it's still true today. And for those of you who have had a chance to examine what's happening in single-payer countries or all-payer systems, the problems tend to revolve around access, lengths of delays in receiving services, and Americans are not particularly fond of queuing up for anything, especially healthcare. So if there was an easy solution, I'm sure that we would have examined it, but again, there isn't a magic bullet in this regard.
I'm wondering what suggestions you may have to encourage young students to become primary docs, shortening their undergraduate time or scholarships, or what might we do to encourage the whole healthcare service?
Yeah, you know, the issue of primary care is an interesting one, and that is there are fewer and fewer people going into primary care specialties today for a whole variety of reasons. I'm not so sure that shortening the amount of education or training time is necessarily the right thing to do. But put it into this perspective. The average medical student today coming out of medical school carries a debt burden of somewhere between $150,000 and $200,000. Those loans, unless they're going to be forgiven through some form of government payback, which is rather unusual, but can happen, have to be paid back. Family practice physicians are among the lowest paid physicians in our entire healthcare physician hierarchy. And if you take a look at the reasons today why medical students are choosing to go into medicine, the good news in terms of the good point that you raised is that when queried, about 73% of graduating medical school seniors, and when asked, what is it that's going to be most important to you as you enter a career, 73% said lifestyle. About 35% to 40% said financial. If you were to go back and do that same review 15 years ago, it would be just the obverse. Primary care is such an important profession and such an important field today that I think the issues that have to be addressed are either loan forgiveness for people entering primary care through some appropriate fashion, increasing payments to primary care physicians, having a better understanding of the workload that they have to deal with. Because when you're in primary care, granted, most physicians today are in groups, but when you're in primary care, you're on call 24 hours a day, 7 days a week, for the lowest amount of payment of any physician specialty in our system today.